Good morning. It's January 31st, 2023. I'm Dr. Duke Majan, the CEO and founder of Duke Spine Institute. We are going to be doing our second surgery of the day, which is lower back, in a patient who has back pain and left leg pain. So he's debilitated with pain so much that he can't even walk without a walking device. And I've identified two targets on his MRI that correlate with his pain. I asked him, "Where is your pain?" He said it's in this area here. And when I see that, I see two discs that are the source of the pain. That's the L4-5 and the L3-4. So we're going to access those discs transforaminally, first with a spinal needle. And then we're going to we're going to fix them. All right, I'm going to aim for the 4-5 first. All right, Jordan? Yes, sir. Shot. So, spinal needle is the first step here. And I have to navigate shot. So, let's try to see there's a little scoliosis. Not bad. It's not bad, but I'm hitting the facets right there. Shot. All right. Now, our patient is from, is it in Indiana? Boise, Idaho. Sorry. Hopefully he doesn't hold that against me. Shot. All right. Boise, Idaho. For all those out there watching, shot. Our patients, 80% of them now come from other states, other countries. Shot. Perfect. So we're getting around the arthritic percent. What is that movement happening here at my waist? Shot. All right. So we're just there. Is shot. Just behind the herniation. AP. At L4-5. You guys see that?
Yes, we do.
So it looks like the needle is going through bones, but it's not. Somebody asked me the other day, Dr. Duke Majan, does the needle go through the bones? The answer is no. We're going around the spine. You guys can see that on the AP view. Jordan, show them the spinal needle. You guys see that black line? That is the needle, and that is a front-back view. It's coming from the side. We're entering a hole in the back of the spine called the neuroforamen. Happens to be the same hole where the nerves are getting pinched by the herniations. So we're at the L4-5. It's absolutely perfect trajectory. We're underneath the exiting root. I'm going to go ahead and enter this disc properly. Shot, pretty collapsed, but we're in. I could feel a massive amount of scar tissue here. Shot. Now, what's surprising is this is not a big man, but look at how the needle, and by the way, all of our needles are the same size. Look how the needle is sunk all the way in. Okay? What that tells you is that his spine is really far forward. He's not a big guy. This is the same amount of needle sinking that we would get from a 400-pound person, okay, whose spine is further back. At this point, we're ready to make our 7-millimeter incision. Now, what's unique about this patient, I can tell you, I'm not going to share any of his other details, but this patient could not get anyone to operate on him. He was in horrible pain, using a walker, can't even do anything in life. Quality of life is horrible. He's here with his wife. They found us on the internet, and they wanted the Duke laser disc repair. Why? Because nobody will touch him. He has a heart valve that predisposes him to having strokes. So he's on blood thinners all the time. Very powerful blood thinners called Coumadin. You may have heard of it. Coumadin thins the blood, and surgeons will not touch patients on Coumadin because unless they're having an emergency surgery. And why would we do it? Because we're doing it minimally invasive. And more importantly, this patient's cardiologist was willing to let us do the surgery, keep him off the Coumadin for a short period of time before the surgery. Okay? Shot? Just lay still. You're doing great.
You doing okay?
AP.
You doing all right?
He's fine. This is just the painful area. Like right around the facet. Really painful. He's got arthritis in his facets. So he could not get a surgeon to operate on him. And he came to Florida, and we're going to take care of him, okay? Why? I'll tell you why. Because open back surgery with a big incision and metal infusion would put this patient at huge risk for complications. Okay? Fortunately, with the laser surgery that we do, we can do it safely without doing the open surgery. Okay? We're doing it minimally invasive. And because of that, look how much blood we're losing. You see that? 2 drops, folks. And that's all we're going to lose, the whole case. Basically, probably less than a cc, because 20 drops makes a cc. cc is 1 milliliter. All right, we need him awake, because now we're going to basically confirm. Everyone agrees we're at 3445, which is our target. Left approach. You awake? Lay still.
Can you open your eyes?
Okay, so he's awake.
Keep your eyes open, that's perfect. We're gonna ask you some questions now. Lay still on the bed, try not to move.
So what we're going to do now is we're going to confirm my diagnosis. What's my diagnosis? My diagnosis is that these 2 discs are causing his back pain. Okay, and if they are, we're going to fix those today. Are you awake? All right, lay still. You're doing great. We're almost done. We're going to put you to sleep soon, okay? All right. So, let's see. Pain is rated on a scale of 1 to 10. 10 being the worst pain of your life, like somebody ripping your arm off with you being awake. Are you comfy? Any pain? All right, very good. No pain. See that? He arched his back. How bad is that on a scale of 1 to 10?
Give us a number. What number?
Said 10. Yeah. Is that where you typically get your back pain? Yes, it is, he said. We call that concordant. So he has 10 out of 10 pain at L3-4. Good news, that pain will be gone when we're done, permanently. You okay? Is it hurting you still, or is it gone away?
Pain gone? How are you feeling?
Still there. All right, we'll give it a minute so it feels better, okay? Now, we do several things here, folks. Number 1. Oh, Jordan, show us where the tear is. Can you see this, Henry? Yeah. It's actually, that's the needle right there. So go below the needle. Yeah, down there is where the tear starts. You see that dye leaking up and then snaking out right there. You see the tear? Show them the tear. Yes. That is the tear. That's where the herniation is, folks. That's where all the back pain. Show them the area of the back pain. It's literally that dragon's head right there. Just circle it. The size of literally a pea. And that's what Duke Laser Disc Repair does. We find the tear that causes the back pain. We treat it with the laser, and it takes the pain away. Are you better? Is the pain gone? No. So still a little bit there? How bad is it on a scale of 1 to 10 right now? 5. All right. Well, I'm not going to get much dye in here because this disc is so scarred up, I can already feel it from putting the needle in. Shot? Can you feel anything there? Shot? All right. Yeah. This is, I can't even push the dye in. That's how scarred up this disc is. All right, let's get an AP. Let's put him to sleep. We're done. So at this point, we've done our discogram at 3.4, 4.5. I couldn't get any dye really in at 4.5, very little. And the reason is because it's so arthritic and collapsed that I couldn't even inject dye into it. So scarred up. So when we get in there, you're going to see a massively scarred up disc. All right, we need you to count out loud from 1 to 100. When you wake up, your surgery will be over. Once again, this patient has suffered with back pain for how long? 3 years. Huh? 3 years. 3 years, severe back pain for 3 years. Nobody would treat him. Nobody would do anything. They're all scared because he has a blood thinner called Coumadin for his heart. He's had a hemorrhagic stroke, which he required brain surgery to suck it out and save his life. He's a miracle to be alive. But now he's in so much pain from his back that he doesn't want to live in that pain anymore. And I had a long talk with him before surgery. And I said to him and his wife, you could die from this surgery. You could have a stroke. You could have a heart attack. You could have some kind of horrible problem. And he said, I understand that. We're willing to take that risk to have my back fixed. But look how his INR today, we checked his INR was 1.2. International ratio 1.2. If somebody's on Coumadin, a therapeutic range is going to be over 2 to 3 and he's at 1.2. So we got him off his Coumadin for a few days. His cardiologist agreed to do it. And now that he's at an INR of 1.2, we can do his surgery safely. And this is a one and done for back pain. He's going to get fixed, and he's going to be very happy, and he's going to have quality of life. All right, transforaminal, we're going to enter the annular tear and herniation. Shot. It looks brutal, but this is how you advance the dilator into the disc. Remember, we're going through a tear that's already there. We're not making a tear, we're going through the tear that we already saw on the discogram. How's he doing, doctor? Shot? Shot? Beautiful. All right. He's, by the way, in the dye that we inject, we use a numbing medicine as well as a dye to see the actual tear. So we use a dye to see the tear called Omnipaque. We use another dye, the Duke Spine dye, which I learned was originally made in India many years ago and used for dyeing clothing. I learned that for watching Gandhi. If you haven't watched Gandhi, it's a great movie. It's made in 1985. I had my son watch it the other day, and we really enjoyed watching it, learned a lot about Gandhi. Yeah, oh, he loved it. All right, there's the herniation and the tear. We're inside the annular tear right now. Can you close that, Luis? And so far, patient's doing really well. And he came to us from, I am so bad at this, Iowa? Idaho. Sorry. Shame on me. And his wife is here watching his surgery like you are. And Henry, let's go ahead and show the audience, why does a herniated disc cause back pain? What is it about the herniation that's so painful? We have a video to teach you about the inflammation that happens inside a disc that causes pain.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
Welcome back. As you can see from our video, the pain that people get in their lower back or neck, for that matter, comes from a small tear in the back of the disc called a posterior annular tear. That was discovered here at Duke Spine Institute, and that's why we're able to cure people's back pain. I peer-reviewed and published our data and our findings back in 2012, 2013 for the first time, and of course I've done more publications over the years. Our most recent publication was for the Southern Neurosurgical Society, and we have just published 2 papers. One was an abstract on our data about thoracic Duke laser disc repair. People with a thoracic herniation that's painful, and we did the endoscopic transforaminal Duke laser disc repair in the thoracic spine, and we looked at how they did with their thoracic pain. So these are people incapacitated with thoracic pain from a herniated disc, usually one side or the other, and we went in and did laser on it, and we had a 99% elimination of their pain, thoracic pain, on average, 99%, okay? There's no surgery in the world that does that good except for the Duke laser disc repair. And it was all done outpatient. The patients had their surgeries done in 1 hour, and they went home an hour later. We've had 0 complications with that procedure on the thoracic, and the blood loss was less than 1 cc on average, okay? It's basically bloodless surgery. So, all right, you can see the tear right there, the blue streak. That's herniation in the tear. The white is the actual tear fibers of the tear. And this is scarred material. The laser fiber is the blue, and that's plastic over the fiber. The actual fiber is glass. You could see it. And this is the same type of glass fiber used for fiber optic telecommunication or communication over the internet. You know, we have these fibers that run across the Atlantic Ocean connecting Europe and America, and they're made out of glass, just like this. And impulses, light is sent through these fibers, and that is basically all the surfing that people are doing on their internet is done through these glass fibers. Signals transmitted through the fibers. So in our case, we're not sending the disc, you know, the latest YouTube videos. We're sending the disc energy, laser energy, very powerful laser energy. And this is a destructive energy that destroys the herniation and destroys the scar tissue and bone spurs, anything else we want to destroy that's causing harm to this patient, using laser energy. So, same type of fiber optic cable. And the truth is that the ones used for telecommunication or internet, they're actually much higher quality. The glass tube is like almost perfect. And this type of fiber optic tube is a lower quality, but very, very good for medical. So, all right. Do we have any questions from our audience?
No current questions, but we do have a comment from SPX 730 on YouTube.
Hello, SPX 730. Good morning.
And they said, quite complicated circumstances. Wish it goes well for him.
Thank you. Thank you. I agree. And again, we're not afraid to help people that are suffering, even though they have complicated medical histories or create risk that we don't really want to take. We do it anyway. Why? Because his life will be ruined if he doesn't get his back fixed and he doesn't get out of pain. He has no quality of life. And his wife, who's by his side every day and loves him and cares for him, well, her quality of life is not good either, right? Think about it. I mean, is your spouse just going to abandon you when you're in pain and go out and have a good time? Or are they going to stay with you and take care of you? Of course, your spouse is going to stay with you and take care of you if they love you. Okay? His wife's a nurse? Uh-huh. Oh, yeah, we have a lot of nurses, by the way. One of our surgeries today will be a nurse, actually. Can't talk about who it is, but I can tell you they're a nurse. And she's coming up later today. We have a lot of nurses. Because nurses, they see all the bad results from open back surgery. They don't want that. And so when they see the Duke laser disc repair, they travel from all over the world to come here, and literally all over the world.
They're really informed.
Yeah, they're the most informed. They're better informed than doctors. No, really, they are. Not you, obviously, but a lot of these like I said, I was at a complication course in Utah, and it's a closed course. You have to be specially invited because these are top spine surgeons at the top universities in the United States. So they don't want their dirty laundry being aired. But of course, I was invited by the head of the course. And anyway, I sat there and I watched these complications that these guys and girls, because it's both, there was men and women, neurosurgeons, that they have. And I could tell you, almost every complication that's related to degenerative disc disease, it all could have been avoided had they done the endoscopic surgery. The only reason they got complications was because they chose to do fusions. And none of them are doing really artificial discs. I didn't see any artificial discs being put in. And these are the top academic universities like Washington and San Francisco, UC San Francisco, a lot of the top centers with the leaders and pioneers in technology of the United States. Most of it's metal technology, but they're all having problems from their surgeries, right? And the reason they're having problems is because they're using old technology. But nurses, like the nurse coming in later today to have her surgery, she studied the internet, she knew her options, she educated herself, and she recognized that this endoscopic surgery is the best in the world. And that's why she's here, to get it done. Okay? Any questions from the audience?
No current questions.
All right, a lot of scar tissue here. These discs have been very badly damaged over the years. You can tell. You can see a little bit of epidural bleeding from Batson's plexus. Now these surgeons I hung out with in Utah this weekend, they were showing their complications. They had complications from both degenerative cases like this, but also from tumors and very complicated, sad cases where patients were in the communities and they had horrible surgery by some community doctor, and they ended up at the university with complications from those other doctors' surgeries. But I can tell you, all the degenerative complications I saw could have been avoided if patients had endoscopic surgery instead. All right, we're at the back of this disc. I'm pulling out all the pieces of herniation that I can. I'm feeling them, they're very hard. A lot of calcified pieces of herniation here. Very, very degenerated. Henry, let's run our video on how the Duke laser disc repair actually works. Why does this surgery work to cure back pain from a disc problem?
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
All right, welcome back. Now you can see how the Duke laser disc repair procedure actually works. And I just want to say, since we don't have a question right now, that, you know, if you watch the development of endoscopic surgery in every other part of the human body, and let's just take orthopedics, okay? Originally, orthopedic surgeons used to treat painful joints with fusing those joints, okay? They would fuse your knee, fuse your hip, and they would take the knee pain away, hip pain away, shoulder pain away. But then somebody discovered, well, you could do an artificial joint, you know, an artificial shoulder, artificial knee, artificial hip. And the beauty of an artificial joint, a fake joint made out of metal, is that the artificial joint doesn't hurt. It doesn't cause pain, you see? However, and it preserves movement, whereas fusion does not preserve movement. So the original endoscopic surgery that came along for knees and hips was really designed to get rid of pain, preserve movement, but also not need to put in metal, okay? So we went from getting rid of pain but losing movement with fusion to getting rid of pain and preserving movement with artificial metal joints to just repairing the joints endoscopically. And that's what we're doing here at Duke Spine. We repair your joint. Rather than get rid of it, we're done here. Let me just do one more grab. We repair your joint. The painful joint is the painful disc. And we're doing a repair. Oh yeah, thank God I grabbed that. Look at that. That's a big one. Yeah, look at this herniation, guys. Let's turn on the lights. I saw it sitting there. I'm thinking I better try to grab it out. Look at that. That was the herniation we just pulled out. Can you guys see this?
Yes, we do.
So let's get the ruler. Where is it? So we can see just how big this sucker is. So we've taken out a few pieces, and now here we go. Can you see this, Henry?
Yes, we can.
All right. So there's the metric. We like to do everything in metric. Makes us things feel bigger. And look at that. So that's over 1 centimeter. It's about 1.5 centimeters long, and it's about 1 centimeter wide. That's a big herniation. Beautiful. Take it. We'll send it off to the pathologist. Let's go take one more look. Make sure we're not leaving anything else. I'm very happy, and we're pretty much done with this disc. Let's just look and see. You guys like that? So that's a blood vessel right there, a little vein, and I don't see any more herniations. Let me just go in there and just grab just to make sure. I'm not really getting anything else. Very happy. There's where it came from. I'm going to do one more grab, just see if there's anything else. Oh yeah, there's another piece right there. Look at that. We hit the jackpot. Jackpot of herniations. All right, might as well do it again. Hey, we're on a roll, right? This is like the winning lottery ticket right here. All right. I don't think we're going to see quite so much herniation at the next disc. That's going to be the number 4-5, because that thing is just stuck together, and I don't feel anything else in the epidural space. So we're done here. We're going to clean this guy out, and there's a little bit of fat, some bleeding off the end plates. Done. Anyway, during this conference in Utah, as they're presenting all these complications from doing fusions on patients, I'm sitting there, they're saying, would anybody have done anything different? And I said, yeah, I would have done it endoscopically. And they just kind of look and they're like, okay, whatever, right? Like, who the hell is this guy? What they don't understand is that I'm literally 30 years ahead of them with this technology. And they're so far behind, and they keep digging themselves in a deeper and deeper hole, you know? And they're coming up with new types of screws, you know, coated with hydroxyapatite, or, you know, adding kyphoplasty cement to their constructs in people with bad bone with osteopenia, and they're extending their fusions all the way up to the thoracic. Instead, all you have to do is one little procedure like this, and you're done. And the patient goes home an hour afterwards.
Yes, thank you.
You're so smart. I love it. Bring it in. All right, done here. Taking out our tube. So far, we've lost literally 10 drops of blood at most. 10 drops. In a patient who has been on Coumadin for years because of a stroke, we stopped the Coumadin, but you can see how bloodless the surgery is. Come on, let's go, Jordan. We haven't got all day, buddy. Any questions, Henry? Hold this.
No current questions, but we do have a comment from SPX 730. This is when they comment when you pulled out the over centimeter herniation. They said, "Yep, that was a lovely one coming out."
All right. Thank you for appreciating our work. Okie doke. Why is this table hitting my butt? No. I think we're okay. It was just a little close. Shot? All right. I'm taking the next needle out. I've put the guide wire in. We're going to go over the guide wire. Okay. Again, dilator. Those of you who haven't seen it. And I need some num-num to make my anesthesiologist happy. See that, guys? No bleeding. If this patient had gone to any of those academic centers, Harvard, Columbia, Hopkins, Yale, that were represented at our meeting this weekend, San Francisco, UC San Francisco, if they had gone to any of those places, this patient, number one, they wouldn't operate on him. I think we've got a little cloggage, Luis. They wouldn't have operated because, and they didn't, because he's too risky. Shot? And if they ever did operate, they would do a multi-level fusion, which is really bad. So, all right, we've got about 15 minutes left. Dr. Berndes, shot, 15 minutes. As I said before, this disc is severely collapsed and degenerated. Hold on. Help me. Alrighty then. Yep. Wowza. Wowza. By the way, I hit my own finger with the hammer.
Oh, good.
Just want you to know that I'm an equal opportunity smacker with the hammer. Not just you, but me too. I'm not targeting you, okay?
Thank you.
All right, so that dilator went in really difficultly. That dilator is about 6 millimeters, 5.8 millimeters wide. And just to give you an idea, the disc space normally is over 2 centimeters, 20 millimeters. So just to get it, you know, a 5 millimeter wide, 5.5 millimeter wide piece of metal in there was a struggle. So almost done. That's good. Let's pull it out. We're almost done. Patient's a little light. We're going to put him deeper, make him a little more comfortable. All right, perfect. This is our second disc. Dr. Berndes, he's fine at this point, I think. So, in other words, he seems to be well controlled. Here, a little piece of herniation. Can I see? Yep. All right, any questions from our audience?
No current question.
All right, the next surgery we're going to do is going to be another lumbar Duke laser disc repair after this one. This one's almost done. This patient will go home in about, probably about an hour after his surgery. And when I say home, I mean actually, obviously, I'm talking about the hotel where they're staying with his lovely wife. Is there another family member too? I thought I saw 2 other people walk in. Son-in-law? Excellent. Well, just to let this family know, everything so far is going very well, in case they're watching. By the way, all of our patients you watch broadcast, they give permission to be broadcasted ahead of time. And we don't tell you their names. We maintain their anonymity. But we do ask them for permission to broadcast and get that from them ahead of time. Some people don't want to be broadcast, and that's understandable. Woo, look at all that. It's almost like this disc is trying to fuse itself. Little bit of herniation right there, you see that? Wiggling and jiggling between the bones. Uh-huh. Just about done. I need 2 minutes. This is not much work to do here. Uh-huh. Oh. Well, Dr. Berndez, you have been on my good list this week. So, you know what is weird is that there's something in the room creating a shadow on this screen. You guys see it? And it looks like the end plates, but it's not to me. I'm sure you guys are not seeing it, Henry. But it's like a door or something. It's something. No, I don't know. It's something in the room straight, but it's something over my left shoulder. No, you can still see it, right? You guys see it too. I'm not imagining it. Okay, any questions? Because we're almost done, and this would be a good time to ask.
Yes, we have a question from SPX30 on YouTube.
Yes.
And they ask, when you're done with the herniation, what are those injections you do afterwards? Just rinse and inject antiseptic?
Yes, that's correct. Antiseptic primarily, and the antiseptic, as we've said before, is called betadine. Betadine is an iodine-based antiseptic developed by NASA, who, we're not part of NASA, obviously, but NASA is just down the road. And, you know, once in a while, we'll run down there and grab some betadine. Right, Luis? Betadine is used all over the United States for surgery. And basically, when surgeons do surgery, we like to rinse our wounds out at the end of the surgery with something that kills bacteria and, you know, anything else like fungus, whatever, that could possibly get in and cause an infection. We call it a, you know, irrigation. So that's what we're doing. And then you have clear water afterwards to get all the betadine out, because you don't want to leave too much betadine in the body. It has a lot of iodine in it, and you want to try to rinse it out. So that's what you're seeing us do. All right, we're just about done. This is the end of the back of the disc where the tear is. You can see the epidural fat at 12 o'clock. And like so many of our procedures, this is the worst area where the bad pain comes from, right at the end. So we got to make sure we do a good job at the end. It's looking good.
We have another question.
Yep, happy to take your questions.
This also comes from SPX 730 on YouTube, and they ask, following of your answers, they ask, so the patients must not be allergic to iodine?
That's correct. Patient must not be allergic to iodine. You are correct. If they are allergic to iodine, we're not going to use betadine. We're not going to use anything. Okay? So, great question. Yeah, we always ask. We want to know what our patients are allergic to before we do treatment on them. So that's part of our patient profile, if you want it, where we ask the patients about their allergies. That's one of the first things we ask them when they show up the first time. What are you allergic to? Yeah, very important. Great questions. Let's go ahead. If you have somebody who you know that has back pain or neck pain, and they're suffering with back pain or leg pain from a herniated disc, come to Duke Spine. Let us fix them. That's looking good. Let's just take a look. I wonder if I can see the nerve root. There's the nerve root, kind of, but it's still in fat. So it's really hard to see, but that's where the nerve root is right there. And it looks good. We're not damaging it or too close to it. People ask me, how do you know? How do you stay away? Well, I'm a neurosurgeon. I know I don't sound like one, but I actually am. And I've been trained at the top training program in the world when it was the top training program in the world. It's not anymore, but it used to be. We're done. So to become trained at the top training program in the world, they only take two people a year to train. I was one of the two. And of course they have thousands of top doctors applying from all over the United States and world, and they have to pick two. So I'm not trying to brag, but to give you an idea of my background, I was probably the top choice that year, 1996, to be entering a neurosurgery training program in 1997. And I was literally the top programs in the world were University of Florida in Gainesville, University of Seattle in Washington, and the Barrow Neurological Institute in Phoenix, Arizona, St. Joseph's Hospital. They actually, the chairmans were calling me personally, basically wanting me to come to their program. Of course, my mentor at the time was Dr. Marty Weiss, who was very, very well known, probably one of the most famous, if not the most famous neurosurgeon in the United States and world. And he was a big advocate for me, and he's actually was my advisor in USC Medical School, where I trained, did my medical school. He was the chairman. Anyway, so to some of you, when you look at me doing different things than other surgeons, understand I'm not doing different things because I can't do what they do. I'm doing different things because I can do more than they can do. And I'm doing better things for patients. All right, we're done. And thank God, no bleeding, no hemodynamic issues. My anesthesiologist is giving me the thumbs up. He's well perfused and is very stable. So here it is, 7mm, 1/4-inch incision, folks. All done. And he avoided living the rest of his life in pain, and he's avoided a major surgery elsewhere with fusion metal happy surgeons. All right, type your questions up. I'm happy to answer them for you. And I'm going to come over there and do it face to face. I'm going to go say goodbye to my cervical patient because she's ready to go, I believe. Yep, the first case we did was a C67, C7T1, anterior transdiscal. And that patient is doing wonderful. She's going to leave in a minute. And then this patient will be gone in about 45 minutes. So next one is our nurse, correct? 2-level L4-5, L5S1. She has 2 herniated discs. She's had prior microdiscectomy. It didn't work. Now we're going to fix her with the Duke laser disc retriever. I'm going to call the EBL 1/2 mil, 0.5 mil. No complications. The INR was 1.2. This was a left. Henry, if you want to go to a testimonial.
I'm Dr. Arjik Majan here at the Duke Spine Institute with one of my patients who's traveled from North Carolina because he had some herniated discs in his lower back and he was having problems with the back. What kind of problems brought you to Duke Spine Institute?
Dr. Duke, it was severe pain that I had never experienced before, and pain that scared me so much that I thought it was going to change the way I lived. I've got a family and I'm active, and it literally scared me to death. And as I'm talking to you right now, the hair standing up on my neck, the pain that I was suffering and where I thought I was, I didn't think there was going to be an answer.
And you were pretty much bedridden. You couldn't get out of bed. I remember you showed up here in a wheelchair because any standing was causing sciatic type pain in your leg.
Yeah, there was no doubt. And that's not an over exaggeration where I could maybe get up, like stand for 15, 20 seconds so I could get to the bathroom to go urinate, for instance. But then when I got there, I had to lay on the floor so I could rest up a little bit so I could stand with pain to even be able to try to urinate. And this went on for 2.5 weeks. It was absolutely brutal. And there was no respite. Pain that I had in the past, I could find some position where there was some respite from the pain, and there was nothing.
So your wife is a physician. Was she able to fix your back problem for you?
I wish. No, I mean, she consoled me. And in the town that we come from, we know a lot of folks. And to be absolutely honest, we just weren't getting a lot of help. And like I said, we know a lot of folks, and it was prolonged, and we were talking about pain management and all that, and that's just not for me. And like I said, I was scared to death.
The problem with pain management, unfortunately, is that it doesn't fix the issue when you have a herniated disc and back pain from a herniated disc, because you need surgery on that disc to repair it. That's what the Duke laser disc repair did. And you can actually see here that we went into his disc with the endoscope and we were cleaning out the herniation with the laser.
Yeah.
And the laser actually makes a huge difference. I'm Dr. Duke Machen here at the Duke Spine Institute with one of my patients. All right, so now you've had the surgery. How are you doing today?
I feel awesome. I mean, the only pain is, surgery site pain, and that's
Okay.
it. No nerve pain.
So the pain that you had before the surgery is
Gone.
gone, cured.
Gone. Yeah.
Awesome.
Yes, that's amazing.
I'm Dr. Duke Machen with the Duke Spine Institute, and I'm here with one of my patients who just had the Duke laser disc repair on her lower back, and she wants to share her story with you. Now, you came to Duke Spine Institute because you were having back and left leg pain for how long?
The terrible left leg pain, probably about 2 years, but prior, I've had issues since I was 14 years old. So it's been a lot of roller coaster pain since then.
So you've had back pain since you were 14. You're clearly not 14 anymore.
No.
And so that's like 15, 20 years, right?
Yeah, too long.
And so why didn't you get it fixed sooner?
Well, the doctors when I was younger didn't want to operate. They wanted to, I was young. They didn't want to take a chance because all the surgeries then at that point, there was just nothing there that wasn't going to be traumatic to my back and my spine. So I went through physical therapy, shots, decompression. They did that and nothing was really working. And then it eventually kind of got better, and then it would get worse and it would get better, and it was just up and down, up and down.
Up and down. And the reason it got better was the inflammation from the injury to your disc started to get better.
Yeah.
But then you'd have another herniation with activity, and then it made it worse. So
Yeah.
when we were in there, and you can see from this video right here that we were pulling out lots of big fragments of disc herniation. You probably over your lifetime from 14 until now had at least 10, 20 different episodes of herniation, and that's what we saw when we were inside there.
Mm-hmm.
All right, so now you've had the surgery. How are you doing today?
I feel awesome. The only pain is, surgery site pain, and that's
Okay.
it. No nerve pain.
So the pain that you had before the surgery is
Gone.
gone, cured.
Gone. Yeah.
Awesome.
Yes, that's amazing.
Now, you're not from Florida.
No, I'm from Ohio.
So you traveled from Ohio to the Duke Spine Institute in Florida. Why did you come all the way down to Florida?
There was nobody near us or anywhere near us that had any other option besides either getting a discectomy or a laminectomy or a fusion. There was just nobody was doing anything else. And I knew I didn't want to do that again because I'd already had that done. So it didn't work.
Didn't work.
I had a really amazing physical therapist that connected me with you, and the rest is history.
Yeah, your physical therapist found us and was intrigued with the surgeries we're doing here
Yeah.
and sent you here. So what are you going to tell your physical therapist? I call him Dr. Salinas. What are you going to tell him when you
Oh man, I mean, I've already told him. I texted him the minute I got back to our Airbnb. I said, I feel amazing, and I can't wait to tell all the rest of the patients in our Facebook group, like, this works. So
It does. The Duke laser disc repair really does work. Well, is there anything else you want to say to your fans out there or friends?
my fans and my friends, thank you for praying. Thank you for believing me. I think that's one of the biggest things. There's a stigma around back pain because you can't see it, that people are just faking it, or maybe they're babies. Like, why can't you just deal with the pain? And it overwhelms you. And so to come someplace that believes me and then fixes the problem, and now I'm sitting here and I can be like a fully active mom. So I'm just beyond thankful. Thank you.
Yeah, chronic pain robs people of their dignity and their happiness and joy in life, and also their loved ones, the people that care about them.
Yeah.
Because they suffer with you.
Yeah.
Yeah.
A lot.
Well, congratulations and praise God.
Yes.
You found us.
Thank you very much.
And I think you're going to do fantastic.
I'm looking forward to being strong again.
Awesome. All right. This is Dr. Ari Duke-Machen, CEO and founder of the Duke Spine Institute. I'm here with one of my patients, and you've traveled from where to the Duke Spine?
Idaho.
Idaho, with your lovely husband, and we've had a few conversations. She came here to have her back fixed. How long have you had back pain for?
For over 7 years.
Okay. And what kind of work did you do before you retired, if you don't mind me asking?
It was desk work.
All right. And so you had back pain for 7 years. Did you have an injury to your back, or did it just kind of gradually come on?
It just gradually came on. I actually noticed it first in 2015 when I was gardening and I couldn't be up there for 8 hours. I was into it for about 4 hours and I had to take a break. And as time progressed, my breaks got longer and longer, and the amount of work I did in the garden was less and less.
Understood. And you're retired now. So what's it like having back pain limit your ability to do stuff when you're retired?
For me, it's very frustrating. I can't do that what I want to do. So we kept seeking solutions and nothing was working. They did work for a short while, but that short while decreased over time. It was shorter and shorter. My husband does research very, very well. Through his research, he found you. We read that you can fix my back, and you did fix my back.
That's right.
And I thank you.
You're welcome. So when did you have the Duke laser disc repair done and the Duke plasma rhizotomy?
I had those done yesterday in the afternoon. I am sitting straighter than I have. I'm standing straighter. I'm walking normal. It's like, wow, new me.
Look at that smile right there. I hadn't seen that until just now. So
well, it wasn't there yesterday.
Yeah, it wasn't there before surgery. And how long have you been not smiling because you've been in pain? I mean, really bad pain. How long has the really bad pain been there?
The really bad pain has probably been over the last 5 years. It's something that was really tough to maintain a positive attitude and try to keep a smile on my face and keep Jeff's hopes up. I tend to be a positive person, but there were times when it does drag you down.
Of course, yeah. It's hard living with chronic pain, and especially with loved ones, they have a hard time, relating. Of course, they want to be supportive, and your husband is a very supportive man, obviously. And he's a pleasure to meet. I know he's an author as well. Yes. And so what are you going to do now that you've had the surgery? And you could see actually the Duke laser disc repair procedure she had done yesterday. You can see right here, we went into the discs that were damaged. You had 2 annular tears. We tested your discs during the surgery, and indeed they were causing your pain. So we verified that with our discogram. And then I went ahead and used the laser to clean up the tears that were causing your pain and get rid of that source of pain for you. And here you are, you're doing fantastic. How much of your back pain from before surgery do you still have?
Oh, virtually nothing.
It's gone.
It's gone.
Cured.
My lower back, I have not been without pain in my lower back until your surgery. is constant, is always there. I've never been without it. I'm without it now.
So are you going to go back to gardening?
You bet I am.
All right, very good. And what other things would you like to do now that you have a new back that doesn't hurt you anymore?
You know, the biggest thing I want to do? I want to go fly a kite.
Good for you. Let's go fly a kite then.
That's right.
Well, congratulations on having faith
Oh,
and being
thank
brave
you.
and getting it done.
Oh, not a problem.
Is there anything else you want to say to your fans out there?
I highly recommend Dr. Duke's Spine Institute, Dr. Duke personally, to help you fix your back.
Thank you. Appreciate that. All right. Safe travels.
Phew, that wasn't too bad, was it?
It was wonderful. All right, I'm here with one of my patients who traveled from Australia to Florida to the Duke Spine Institute for treatment. And you look happy today.
Yeah.
Yeah? Why are you so happy?
I'm happy because my back pain is gone.
Your back pain is
and
gone.
my leg pain is gone
Awesome.
from the disc. Yeah.
From the surgery yesterday.
Surgery yesterday. Yeah.
And you had the Duke laser disc repair.
I had the Duke laser disc repair. Yeah, that's right. Yeah.
So why did you come all the way to Florida from Australia for the Duke laser disc repair?
I've been suffering from back pain and leg pain for nearly a year after an accident. So I did a lot of conservative treatment like physiotherapy, exercise physiology, but it hasn't cured my pain. The pain was chronic, and I've been suffering from a lot of issues, emotional frustrations and things, and sleepless nights. But a couple of neurosurgeons back in Australia has offered me a surgery. They both offered me a fusion, which I don't want to go for. So then I have looked into Dr. Duke. I found Dr. Duke, and he's doing an amazing job doing a laser technology and also doing very minimally invasive procedure. So I thought this is what I wanted, and it's a faster recovery. I could go back and work back within a couple of weeks. So that's why I traveled all the way from Australia to US.
Yeah, and we did your surgery just yesterday evening.
Yeah.
So it's around 12 hours now from the surgery, and your pain is gone. And you can see in the video here where we did the laser surgery, we got into your disc endoscopically, and we used the laser to clean the tear in the back of the disc at L5-S1 where their pain was coming from all the inflammation. And now that back pain is gone. And you didn't have to have fusion. You didn't have to go to the hospital. You didn't have to deal with narcotics, right?
Yeah.
You said you took a couple of anti-inflammatories and a muscle relaxer yesterday.
Yeah, but I didn't have much pain about with the surgery because it's laparoscopic and minimally invasive, I believe.
Yeah, that's correct. That's correct. So there's not a lot of trauma. There's no scar tissue. There's just a little incision. And of course, we don't remove any bone or ligaments from the spine. It's all done minimally invasive and naturally. So it's a natural healing of the disc. Now, you said just a minute ago you were suffering with a lot of pain and the effects of pain on your psychological well-being. And I know what you do. You're a nurse who helps patients that have behavioral issues, like anxiety, depression, and maybe other things. But you can appreciate how devastating chronic pain can be on people and their loved ones around them.
That's true. Yeah, I completely agree. It not only disturbs you, also your family. That's what I understood. So psychologically, after a few months, I should say, you will have that frustration of chronic pain, and then your behavior start changing towards others as well. And it's not really, about you. It's also about your people living around you. That's very important. Yeah.
You came here for a purpose. You got your surgery that you had hoped to do. Now you're going to go back to Australia.
Yeah.
You got a long trip ahead of you coming up. And how do you feel about your experience here at Duke Spine overall?
Oh, it's really good. Staff is really welcoming, and it's spot on, and they receive you with a smile, and which is really great. And my father was telling, oh, it's amazing how, he never thought that in American health system, people like, the clinicians are like this. So he was treated differently probably before while he lived in US, but it was really amazing. And your staff is really cool. I should say, yeah, they're welcoming, they're good.
Thank you very much.
And you are the best, I should say.
Appreciate it. It's an honor to take care of you, and it makes me feel so satisfied to see you happy and out of that pain. So congratulations.
Thank you, doctor.
You're welcome.
Yeah. If you're suffering from back pain, this is like a very good cutting edge technology and very advanced surgery, which Dr. Duke has developed his own, and without minimal, no damage to the bone, no damage to other things, and easily approaching to the disc and removing it. He is very skillful in reaching there without, manipulating any of your muscles or anything. And you can see from me that I have recovered within few hours after the surgery. So I would say if you don't want a long-term complications from the surgery, this is the best surgery you can get done by Dr. Duke here.
Congratulations once again.
Thank you, doctor.
And good morning, I'm Dr. Ara Duke-Majin, CEO and founder at the Duke Spine Institute in Florida. I have one of my patients who just had surgery yesterday, and he traveled from New York with his lovely wife, and they are here for the Duke laser disc repair, which he had done yesterday morning, just 24 hours ago. What kind of problems were you having with your neck before the surgery yesterday?
So 20 years ago, I had a pool accident. And then in 2009, I had seen a doctor and I had a fusion done. And then after that fusion, which was C5, C6, years went by and I started having problems again with the neck. Severe pain, sharp pain going down into the arm, pains along the back, problems sitting, problems sleeping, constant pain. Went to pain management and tried a list of different type of chiropractic, physical therapist, and just couldn't get rid of this pain that I had in my neck.
Right.
So I was recommended to see a surgeon in the New York area. I went to him and he recommended a fusion of C6, 7.
Right.
So I researched more and I found you online, and we had a Zoom meeting and you reviewed what my issue was from an MRI, and I was just amazed at what you told me you could do with no long-term effects. I mean, here I am, I had surgery 24 hours ago. You would never know it. Look at me. You're not holding me up, right?
No.
Is that amazing?
This is
Truly had
technology.
surgery,
Yeah.
truly. And I feel so much better.
It looks like you're turning your neck a lot better.
I am, see that?
No pain.
Without
with that, is it?
hesitation.
Yeah,
So that's
just like
great.
that.
They just took my Band-Aids off. I walked in here, I feel great. I don't have any pain in my shoulder and going down my arm. I can lean back now with no burning sensations in the neck. It's just amazing. And my original fusion, when I heard they wanted to do another one, I was worried because it was so painful. I must have been in bed for a week and a half before I can even move around. And they put a drainage in your neck. It was just very uncomfortable.
Barbaric.
Yeah, it was like crazy. And then I'm like, why isn't everybody coming down here?
They should, because we have figured out the right way to treat herniated, bulging, degenerative discs in the neck, and it's with a laser and endoscopic surgery. And you found us, you came, you experienced both, because you had the fusion years ago in 2009, now you had the laser. How would you compare the two in your mind?
Night and day.
Yeah.
I mean, I would never get a fusion again. Never.
Well, now that you've had your surgery, I know you were asking if you can go to the beach today and go in the water, and I said yes. What kind of things are you going to do now that your life is going to be without this pain?
My activity is going to be much better, and enjoyment of life, my family. Don't have to go lay down in the middle of the day when people are over. It's just going to be great. It's a new start.
Absolutely.
So I appreciate it. Thank you
You're
very
welcome,
much,
sir.
Doc.
That's why I'm here.
Perfect. Great
Anything
job.
else you want to say to your fans out there?
Just listen, it's the good doc here does an MRI review. He doesn't charge you for it. And you'll get to meet him and you'll get to see, you get his opinion on what you need, and you're gonna end up being very happy. It's a short ride or flight. I'm coming from New York. It's well worth the flight down here.
Yeah, we couldn't tell you were from New York.
Oh, you couldn't tell by
I'm
the way I talk?
Yeah, of course I can. Well, congratulations.
Thanks so much.
So happy for you guys.
See, I'm up. I feel good.
Good.
Yeah.
That's why we do it. You're welcome. Back injury, and it was around 6 to 8 weeks ago, and you're back for a checkup. How you feeling today?
I feel wonderful. I feel great. I feel fantastic. I mean, this is the man. He's the man.
Well, thank
And I
you.
came in with a lot of pain, a lot of pain. I couldn't believe it, and now I'm virtually pain-free. It's unbelievable.
How long did you have your back pain? How did that start?
Oh God, that happened many years ago at work. At least 20 plus years. And I had other surgeries in the past, and they really didn't help. And this last one, it just got so bad that I had to do something. I had to do something. So luckily, through the grace of God, I came here, and
Amen.
yeah, and I'm A1 now.
Awesome. So you had your surgery. You've been doing therapy. Would you say the pain you had in your back before surgery is still there, or is it gone?
Oh, it's gone. It's gone. I have little twinges now, but they're muscular, and which is fine. That's going to go away over time. But my God, what a relief! I'm ready to get back out there and do all the things I used to do, man. It's kind of exciting. It's kind of fun.
Well, it's important that people understand too. When you have 20 years of chronic debilitating back pain, what happens is the muscles in your back shrivel up and atrophy because you're really not active anymore because it hurts too much. So, you know, we can fix the spine pain, but it's going to take time to rehabilitate the muscles and get them back to normal. So I'm glad we're touching on that. So what does your life look like now that we've gotten rid of your back and leg pain?
Well, yeah, I'm going to go back to what I've always done and what I've always enjoyed doing, which is my automotive hobby. And I'm really looking forward to being able to actually lift things again and getting the contorted angles that I used to get working under cars and stuff. It's just gonna be nice. Quality of life is it's
not too soon with any of that lifting engines.
all right, yeah, all right. But I have, all kidding aside, I have noticed over the years I developed a way to walk, almost a crab walk kind of thing, and I got used to it, and I got, well, that's the way it's going to be. I don't have that now. I mean, it took a little while because it was some pain trying to get the muscles to come back. But my God, you just stick with it. If you got to get it done, stick with it, because you're going to get better. You're going to get better.
Well, congratulations. Is there anything you want to say to wrap things up to your audience?
He's the man. Come see this guy.
All right, congratulations.
Thank you, doctor.
You're
God
welcome,
bless.
sir. God bless you. Okay, Dr. Dumajian, we're just finishing our second surgery for today, January 31st, 2023. And this patient came to us from Idaho with, got it right, 2 bad discs in his lower back. So here's the spine segment. It's basically bone, and a disc in between. This is called the foramen, this opening in the bone, the foramen, F-O-R-A-M-E-N or I-N. And there's a nerve that leaves the foramen at the levels that we treated, L3-4, L4-5. That nerve exiting, so for example, if it's the L3-4 disc, it's the L3 nerve root. We went just underneath it, right into the herniation with our tube, and we'd use the laser to clean it out. Every other doctor goes through the back, they take off the bone, the ligaments, they weaken your spine, and they end up trying to pick pieces of the herniation out. It's very bad. Endoscopic is the way to go. It's the very best. That's what you saw. Patient did well. His pain was definitely coming from those 2 discs, and we confirmed that with a discogram. So
again, his issue was he couldn't get help because nobody wanted to operate. They were all thinking laminectomy, discectomy, fusion, and he has a problem with the heart where he's got to be on Coumadin or a blood thinner, and they didn't want to stop his blood thinning to do a surgery, so we did it for him.
Can I ask you a question?
I'm live right now. Just hang out for a minute.
Okay.
Our first surgery has already left. She's on her way out. She was the 2-level cervical. She's doing fantastic, and we'll see her tomorrow and hopefully do a nice testimony. Any questions?
No current questions, but we do have a comment from Cheryl Rob on YouTube who just comments, "I will see you soon, Doc."
All right, Cheryl, very nice. Thank you for the comment, and we'll see all of you hopefully soon to get fixed. Have a nice day.